Hello, ladies and gentlemen. My name is Michaela Blue, and I'm a student in the undergraduate program at Francis Marion University. Today, I will be talking to you about ADHD and stimulant medication as they relate to children. When we see an elderly person pull out one of those containers that have a space for the pills that they take each day of the week, we think nothing of it. We say, oh, they're probably blood pressure pills or medicine for diabetes, and move on. But imagine an elementary school age child, God forbid it be your own child or a sibling, pulling out one of these containers. Most, if not all of us, would be deeply concerned. But why would we be concerned? We would be concerned because children ingesting such a significant amount of medication is alarming. This is essentially what happens when the children with ADHD are prescribed stimulant medication to suppress their symptoms. They are forced to ingest vast amounts of this medication to conceal the traits of the disorder. However, the side effects that develop in children with ADHD who are treated using only medicinal methods are far worse than the prominent symptoms of ADHD itself. Children with ADHD who are being treated using medicinal methods are being overmedicated. Medicine has overshadowed the other forms of treatment that have proven to be effective in children with ADHD. Children with ADHD who are being treated using medicinal methods are being overmedicated. Medicine has overshadowed the other forms of treatment that have proven to be effective in children with ADHD. While medication is an extremely effective form of treatment, it may not necessarily be the safest method to use in children. Stimulants work for a remarkably high percentage of patients. Research suggests that between 85 to 90% of children with ADHD will respond to one of the available medications. The medication is administered frequently throughout the day. Constantly administering medication to children with this psychological impairment causes them to consistently be in a chemically induced state, which is one of the fatal side effects. Specialists are concerned that doctors are not correctly diagnosing children with ADHD. According to Goldman, there have been allegations that the diagnosis is merely applied to control children who exhibit unwanted behaviors in the classroom or elsewhere, and that medication is simply used to control such behavior. In lieu of the fact that in prepubescent children, stimulants enhance attention and focus as they do in adults, but reduce physical activity and energy, Goldman also states that some critics have complained that overemphasis on psychopharmacological treatment has led to neglect of other treatment modalities or served as a distraction from family problems or school shortcomings. Although more children respond to the use of stimulant drugs than any other form of treatment, there is a possibility that children are being exposed to the side effects of this medication for no purpose whatsoever. Behavior in children of a certain age almost always resembles some of the symptoms of ADHD. Without proper testing, this could possibly result in a misdiagnosis, an unneeded prescription, and thus a dependency on that particular drug. In addition to the fact that children are administered the stimulant medication too frequently, there are a number of extremely hazardous side effects that doctors put children at risk for when they prescribe the stimulant medication. Doctors should not be allowed to put children at risk for the disorders that could possibly be fatal just to suppress the initial ADHD symptoms. Researchers have found that children are commonly prescribed stimulant medications such as methylphenidate, Ritalin, to control the symptoms of ADHD. Despite the fact that a few non-stimulant medications such as atomoxetine, guanfacine, and clonidine are also available, researchers say that methylphenidate, created in 1955, now accounts for more than 90% of the stimulant use in ADHD in the United States. Another specialist states, although it may seem counterintuitive to treat hyperactivity with the stimulant, these medications actually activate brain circuits that support attention and focused behavior, thus reducing hyperactivity. However, potential side effects include depression, dizziness, headaches, appetite loss, insomnia, and nausea. Not only are children in a chemically induced state, but the medications themselves can cause other impairments that could physically damage children, and although they may be short-lived, they could become life-threatening during the time that they are present. Children are exposed to far more when they are medically treated for their ADHD than they are if doctors would use some other form of treatment. Not only are the children exposed to the problems that I previously stated, there are other byproducts of stimulant medication. Sleeping problems are prominent in children with ADHD who are being treated using stimulant medication. It is possible that these problems are due to the fact that the stimulant medication has worn off, making it more difficult for them to manage their behavior. It is possible that these problems are due to the fact that the stimulant medication has worn off, making it more difficult for them to manage their behavior. But according to a study conducted by Stein, children with ADHD treated with stimulants were reported to display a higher prevalence of nightly severe sleep problems than did untreated children with ADHD. It has also been proven that many children with ADHD have difficulty sleeping at night, whether or not they are on medication. However, stimulants are known to increase amounts of dopamine in the brain. Dopamine controls our circadian rhythm, which allows the brain to adapt to certain times of day. Dopamine levels typically increase around the middle of the day and decrease once it is time to sleep. This, in turn, causes the children who are treated with stimulant medication to experience sleeping problems, specifically not being able to fall asleep or stay asleep. In the same study conducted by Stein, it was found that almost a third of stimulant-treated ADHD children are reported to display sleep latency or insomnia every night versus 10% of untreated children with ADHD. The children who were untreated showed a significant difference in sleeping patterns. There are other options available to treat children who have been diagnosed with attention deficit hyperactivity disorder. However, there are a host of alternatives that are being used that do not have a positive effect on the behavior of children with the disorder, which is a major component of ADHD. Among these alternatives that do not produce the desired effects is a method called cognitive training. Although cognitive training does not affect behavior outside of the classroom, the study shown in Figure 1 suggests that it can help improve some working memory tasks. Figure 1 depicts the effects of cognitive training on working memory tasks. The more cognitive training the child underwent, the better the child performed on working memory tasks. While this is a great method to improve children's short-term memory, memory isn't primarily affected by ADHD. Cognitive training does not enhance behavior outside of classroom settings, where it is normally administered, nor is it effective outside of the setting in which it is given. However, behavior in classrooms can be improved by cognitive training. While this will benefit both the teachers and the children, there is a key group who won't reap the benefits of this treatment method. Parents spend the greatest amount of time with children with this disorder, and unless the treatment is administered at home, the child's behavior will not be stable at home. Abacoff asserts that in the treatment of children with ADHD, cognitive training has more face validity than perhaps any other therapeutic modality. This is because cognition is affected during ADHD. There have been controlled investigations that use this treatment strategy and provided little evidence of behavioral improvement in youngsters with ADHD. Cognitive training has no positive or negative improvement on behavior outside of the classroom in children with ADHD. This is significant because behavior problems are the most common symptoms of ADHD. So what are the other options to treat ADHD, one might ask? Combined treatment, medicinal treatment paired with another method of treatment, is the best treatment for children with ADHD. It states that the children who received behavioral treatment alone performed as well as those who received concurrent medication throughout the summer. Medication has proven itself to be the most effective method of treatment. However, children who receive behavior therapy alone perform as well as, if not better than, the children who receive only medicine. Since medication is the most effective form of treatment and behavioral therapy creates the same results, one may assume that a combined treatment is not needed. However, in a multimodal treatment study, it was concluded that the combined treatment group showed substantially more improvement than those who received behavioral therapy alone, or community care. Also, the combined treatment approach was consistently superior to routine community care, whereas the single treatments, medication only or behavioral treatment only, were not. When medicinal treatment is combined with some other form of treatment, it is more effective than any other form of alternative treatment alone. However, the alternative forms do not work as well when they are used alone. The parents of children with ADHD should take extreme precaution in regards to the method of treatment that is being used on their child. A choice in methods of treatment could be the difference between a child with ADHD and a child with multifarious disorders. Thank you.